appears to increase among people with pre-existing non-communicable diseases, such as cardiovascular diseases, chronic respiratory diseases, diabetes, and cancer. Here are a few tips for people living with NCDs on how they can protect themselves during this pandemic. Continue to take your medication and follow medical advice. Secure a 1 month supply of your medication or longer if possible. Keep a distance of at least 6 feet from people with a cough, cold, or flu like symptoms. Wash your hands often with soap and water. Quit smoking and avoid using coping strategies involving alcohol or drugs. A healthy lifestyle will make all bodily functions work better, including immunity. Eating healthy diets with plenty of fruits and vegetables, keeping physically active, quitting smoking, limiting or avoiding alcohol intake, and getting enough sleep are key components of a healthy lifestyle. The Ministry of Health encourages persons with non communicable diseases to manage their conditions as much as they can so they do not end up in the hospital. For more information, go to coronavirus.gov.bl. Stay well, Bermuda.
This is a message from the government of Bermuda.
Good afternoon, Bermuda. While phase two is progressing, it is important that each of us are doing our part, following the rules and holding each other accountable. I'm troubled to see people not wearing masks while they're not engaging in physical distancing, and businesses that are not adhering to the necessary protocols. Getting used to what can and cannot be done during phase two will take some getting used to, and mistakes will be made. But quite simply, there is no excuse for some of the reckless behavior that I have seen. There are examples of countries that began to give their people the opportunity to return to work, and people stopped acting responsibly, and COVID 19 cases increased. Bermuda will not be one of those countries. To that end, I have directed the Minister of National Security and the Minister of Health that we will be adopting a zero tolerance approach with regards to enforcement of the rules for phase two. Businesses that are not following the guidelines and the rules will be closed. It is that simple. Most of us are doing the right thing. Most of us are following the rules, and most of us are doing our part towards moving us closer to a day when more of our people can return safely to work to provide for their families. But we can do better, as it only takes one asymptomatic super spreader to set us as a country back. That person could be your friend who had a party where it was too hot to wear a mask, but you were singing and having a good time, and now you are at risk and your family is at risk. Our collective job is to minimize the possibility of transmission of this virus, and that means that we must continue to have our guard up, not just for phase two, three, and four, but for the foreseeable future. This is the new normal. Before we continue with updates from the Minister of Health and the Minister of National Security, I would like to briefly address a matter that has arisen over the weekend on social media and across the community, which is the reopening of the airport and our borders to regularly scheduled commercial traffic. Let me be particularly clear on this matter. The airport reopening is a matter that we are considering and preparing for very carefully. The return of regularly scheduled commercial traffic is currently listed in phase four of our plan to safely bring our country to a place where more of our families can return to work. While we are exploring measures involving a combination of quarantine, testing, and contact tracing technology that will enable us to develop a plan around what traveling to Bermuda will look like, we are not there yet. We will not be opening the airport to regularly scheduled air travel until we are absolutely certain that we not only have the means to protect our community, but that we are absolutely safe to do so. And it would be a great travesty if we were to open our airport only to wind it back. And that is the reason why it is in phase 4, and we are going to make sure that we proceed very carefully. There is an incredible amount of work that is taking place with various ministers to arrive at that point so we can carefully plan for what that will look like. Now, I will ask the Minister of Health to provide an update on COVID-19, the latest figures, and the work which is ongoing within the Ministry of Health. Minister?
Good afternoon, everyone. Between Sunday and today, there were 241 test results received by the Ministry of Health, and none were positive for COVID-19. Bermuda has 133 total confirmed positive cases, and their status is as follows. There are 35 active cases, of which 28 are under active public health monitoring, and 7 persons are hospitalized, of which 2 are in critical care. A total of 89 persons have fully recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 60, and the age range of all of our positive cases is from 18 to 101 years of age. The average age of persons hospitalized is 79, and their age ranges from 70 to 91 years of age. The average age of all deceased cases is 74, and the age range is 57 to 91 years of age. The source of all local cases is as follows. 41 are imported, 78 are local transmission with known contact, 10 are local transmission with an unknown contact, and 4 are under investigation. Bermuda's country status remains at local transmission cluster of cases. Staying physically active is one of the best ways to keep your mind and your body healthy, and in particularly that is important during a pandemic like COVID-19. Under phase 2 of Bermuda's reopening, people can now visit parks, trails, and open spaces as a way to relieve stress, get some fresh air, and some much needed vitamin D. It's also important so that it will allow us to stay active as well as to stay healthy and to connect safely with others. But as we prepare to head into the holiday weekend, I want to give some guidance reminding how to safely enjoy our beaches and parks this weekend. The Ministry of Health recommends that you visit parks and beaches that are close to your home. This diminishes the risk of lots of people making their way to the same beach or the same park. And as we know, the more people, the higher the risk for COVID-19 spread. Play it safe by keeping your space, at least 6 feet between yourself and others. So do not visit crowded beaches or parks where you cannot stay at least 6 feet away from others at all times, unless, of course, they're within your same household. And in situations where you have to be in closer proximity to others, it's critically important that you wear a mask and stay at least 3 feet apart from people who are not members of your same household. And this will make it safer for all concerned. We practice everyday steps such as washing our hands often and covering our mouths when we cough and sneeze. Bring hand sanitizers with us that have at least 60% alcohol content to use in the event that there is not soap and water accessible at these beaches or at the parks. Prepare before you visit. So, for example, ensuring that the restrooms are accessible. Avoid gathering with others beyond your household if you can, and keep your social bubbles small and limited to only a few individuals. Do not share private hot tubs with persons other than your household, and don't use water playgrounds as they are often crowded and could easily exceed recommended guidance for the guidance of the gatherings, which, as you've heard us speak about, is no more than 10 persons. Do not participate in contact sports. Remember that groups of 10 or more are prohibited. These typically require people who are not from the same household or living unit to be in close proximity, which of course increases their potential for exposure of COVID-19. The use of playgrounds and outdoor gym equipment in our public parks is now permitted under phase 2. However, anyone using this equipment should sanitize it prior to its use. And finally, do not visit parks or beaches if you are sick or have recently been exposed to COVID-19. This guidance, as usual, as well as the guidance of other things that we've spoken about in these press conferences, can be found at the government website at coronavirus.bm, .gov.bm. That's coronavirus.gov.bm. And in summary, I would like to encourage everyone to please use common sense in the coming days and weeks. As the weather heats up, the temperatures and the temptation also increase, and that is a temptation that we might wish to socialize with others in larger groups. But please do not do so. As the Premier just recently said, we are not out of the woods. We've just entered phase 2. Think before you commit to a social plan. Think, is this safe? Am I being responsible? Is this plan putting me or anyone else at risk? And if you hesitate for even a moment in answering any of those questions, then please stop and don't proceed. Don't do it. Remember, the more interactions that you have with others and the more you are all out and about in the community, the more at risk you put yourself and those in your household also at risk. I know it can feel awkward to refrain from greeting someone with a hug or a handshake, but it is in fact a sign that you not only respect your health, but you also respect that other person's health by not entering into their personal space and putting them and or your loved ones and their loved ones at risk. We can still be friendly Bermudian selves without having to put ourselves or our loved ones at risk by coming too close. Remember, people who share an environment with someone who is infected or at high risk for infection themselves. And an example of a shared environment is an office or even a restaurant if you're close enough to that person. That is why we have stayed masked if we are going to be within 3 to 6 feet of other persons for more than 15 minutes. 6 feet is the closest you can be without a mask. 3 feet is safe if you are wearing a mask, and only get closer than 3 feet if you are both masked and it is absolutely necessary. And finally, I want to repeat my call to those with family members in the hospital who are medically fit for discharge to please work with the hospital to arrange a more appropriate care setting for your loved ones. Right now, the hospital is at 120% capacity, and there are many persons within the hospital that are medically fit for discharge. And we are pleading with those family members to work with the hospital so that you can take your loved ones home. Every hospital bed is needed for this national crisis right now. Do not put your family at risk by prolonging a hospital stay unnecessarily. Bermuda and our healthcare workers will thank you for doing the right thing. Thank you.
Thank you, Minister. Obeying the rules and enforcing those rules are key to us moving forward and out of phase 2. The Ministry of National Security, the Bermuda Police Service, and the Royal Bermuda Regiment were on our streets and out to the community this weekend, doing their part to enforce the law and to protect our community. The Minister of National Security will now provide an update on the work of him and his team in the ministry over the weekend. Minister.
Thank you, Premier, and good evening, Bermuda. The Bermuda Police Service and the Royal Bermuda Regiment continue to be visible at our businesses, our restaurants, on the water, on our roads to ensure that Bermudians are compliant with the Phase 2 regulations. This past weekend, the Coast Guard engaged with 339 vessels, issued 32 warnings, 27 of which were for curfew violations. Some of the boating public are blurring the definition of rafting up. In other words, people are respecting not rafting up, but when they get into the water, they all are getting together, and the Bermuda Police Service and the Coast Guard are finding it very difficult to separate them whilst they're in the water. We are asking the practice of people getting off their boat and jumping in the water in groups of more than 10 to cease immediately. Again, we are urging recreational boaters to please observe the health guidelines to ensure the safety of yourself and others. The Royal Bermuda Regiment have been making visits to restaurants and retail stores. Over the coming holiday weekend, the Coast Guard will be actively enforcing the COVID-19 regulations. Turning to matters of air and sea, here are a few updates regarding air traffic and maritime vessel activity. Pending the approval of the Bermuda government, Travel Edge is prepared to offer another charter flight from Toronto for repatriating residents in early June. As details become available, we will share the information with the public. There are 7 yachts in Bermuda with crews all under quarantine. These vessels are on the way to the Azores, the United States of America, and Spain. There are 46 vessels on the way to Bermuda between now and July. 7 are container ships, car ships, and tankers, and the remainder are yachts. This is a busy period for Bermuda as yachts reposition from the Caribbean ports in Europe or to the United States of America. However, a number of them do not intend to stop in Bermuda, even though they have filed a pre-arrival notice. In the area of food supply, cargo delivery, and wholesale products, we've had a shortfall of a number of items popular here in Bermuda. However, I am happy to say that many of them have been replenished. Bermuda's 3 regular cargo ships continually to regularly operate and bring goods to Bermuda. There is currently a noticeable absence of paper towel on the shelves. However, we've been informed and advised that stock should be up to snuff soon. Commodities like yeast, as well as flour, have been sourced from different overseas suppliers, and we can expect to see these products soon on our grocery store shelves. Please note, pork, poultry, and hamburger meat is in stock, and cleaning supplies are now back in stock. Turning to hurricane season. As we mitigate the risks of COVID-19, we are also mindful that next week, Monday, June 1st, will mark the start of what is expected to be an active storm season. So our attention is now simultaneously focused on managing storm risks associated with hurricanes. As I've indicated previously, all steps are being taken to ensure that our island is storm ready and prepared. Due to the COVID-19, the Emergency Measures Organization, or the EMO, has been meeting on a regular basis. Consequently, the Atlantic 2020 hurricane season has formed part of our discussions. Traversing through an active hurricane season is not new to the EMO and is not new to the people of Bermuda. Each year, the Emergency Measures Organization builds on the lessons learned from the previous hurricane season. On Wednesday, May 27th, Bermuda will participate in an international tabletop discussion that will interact with 8 other countries to discuss hurricane impact in a COVID environment. These sessions will be facilitated by Bournemouth University Disaster and Management Center. In Bermuda, these sessions will be led by the Disaster Risk Reduction and Mitigation Team, or the DERM team. Areas that will be discussed include shelter management, external military assistance, communications, health management and resilience, and security and protection. As we battle COVID-19 and as we enter hurricane season, I have every confidence that Bermuda is taking the appropriate steps to ensure the safety of her people. Against the backdrop of what we are dealing with as a country with reference to COVID-19, we know that this can be an overwhelming time for some people. So I'm reminding and encouraging our residents to call our confidential emotional well-being hotline at 543-1111 for guidance should the need arise. Bermuda, we are in this together, and we must continue to help and support one another. Bermuda can rest assured that the government remains committed to doing its part to assist our community through these challenging times. Thank you, Premier.
Thank you very much, Minister. As the world is changing, we will all have to change as well. Beyond physical distancing and wearing masks, business models will change, and the approach to providing goods and services to people will have to change as well. On top of that, each of us will need to invest in ourselves, developing new skills and acquiring new knowledge to enhance our ability to compete for jobs and opportunities. The world saw a steady and relentless move away from brick and mortar businesses before COVID-19, and a steady march away from unskilled and low-skilled labor towards technology. This pandemic has accelerated the need for business to be responsive, customer-driven, and innovative, and accelerates the need for each of us to personally and professionally evolve. Those who are slow to change, those who are fearful of change, and those who are too arrogant to accept they need to change will find the coming months and years challenging. Change can be scary. Change can certainly mean that you are forced out of your comfort zone. But change can also mean new opportunities. Opportunities for new businesses to start, opportunities for existing businesses to expand, and opportunities for individuals to create services that may never have existed before. Take, for example, Mr. Nico Allboy, operator of Advanced Air, who today has announced a new dry steam cleaning service to aid business disinfecting their establishments. Or Quincy Jones of Quality Air, who is installing UV air filters or ultraviolet air filters for air conditioning systems that will kill pathogens in the air. This is what Bermuda needs more of. Entrepreneurs who will assist the country in ensuring that we safely navigate the future. If you have a business idea and need help getting it started, please contact the Bermuda Economic Development Corporation. This government and its agencies will support your idea if it is a good one. As a government, we know that we are not exempt from change. Whether it is our MPs and ministers leading from the front, taking a pay cut, or innovating government, making it more responsive, more effective, and more efficient. We know we have to change. We know that we have to evolve, and with the help of the hard-working public service, we have become more responsive, more effective, and more efficient in the delivery of services to our community. As we recognize that we cannot and should not shape reform and change alone, we have reached out to all of you for your ideas and feedback, and I want to thank you for responding. We have seen the suggestions pouring in via the online government forum, ideas that are inclusive, ideas that change the status quo for the better, and ideas that will grow and evolve Bermuda are here, and they are beginning to capture the imagination of our people. You still have time to submit your ideas, to go to the website to read through the ideas, and to vote for the ideas of which you support the most. Please visit forum.gov.bm to share your thoughts or also to support the thoughts of others. You can vote, you can comment on existing thoughts, or you may wish to add your own. As I checked earlier today, there were 222 individual submissions, and I would encourage you to make sure that you go ahead and read through them and engage in that conversation, as it is the method in which we will gauge public views and opinions on the various ideas which are being put forward. As we have effectively managed the health crisis caused by COVID-19, we must be equally as effective in managing the economic crisis which will face our community. Alongside the Economic Advisory Committee established by the Minister of Finance, my focus as leader of our country has shifted towards the reinvention of our economy. As we have broken down obstacles to small business obtaining capital, and we have opened up government contracts so more businesses owned by Black Bermudians, females, and disabled who have been traditionally excluded, we will continue the work to create new opportunities for Bermudian entrepreneurs and business owners. As we have given more Bermudians access to higher education through increased investment in educational grants and scholarships, we will give more Bermudians more opportunities to obtain the skills, certification, or degrees needed to not only become more competitive in our economy, but to be leaders in the global economy. This new spirit that we are seeing in our country, a spirit of optimism, creativity, and innovation, has been matched by a new spirit of camaraderie, a new spirit of national unity, and behavior that embodies the old adage of being our brother and sister's keeper. Bermuda, we have done well, and we have done well together. Let us continue to support each other, encourage each other, lean on each other, and uplift each other as one people with shared goals, keeping our communities safe, getting our communities safely back to work, and dealing with each other kindly, compassionately, and generously, as that is the only way that collectively we will make it through this together. With that, I'm happy to take any questions from the members of the media who are here today.
Thank you. Thank you all very much. Fiona McWhirter from the Royal Gazette. Thank you this evening. Premier, you said earlier that there's going to be a zero tolerance approach to businesses, and I would assume probably by that you also would mean residents with regards to following regulations during phase 2. If that warning was not heeded, would you ever see a situation whereby we might even take a step back into phase 1?
It would be my hope that we don't regress. And I don't want to make it seem as though if there's a significant number of businesses that are not observing the protocols. But Section 13 of the Emergency Powers Continuing Precautions Regulations give the Minister of Health the ability to close any business who is not adhering to the particular regulations. There is no excuse for businesses not following the regulations. They are simple regulations, and we have made sure that we've advanced these so that more persons can return to work and to provide for their families. There will be looks to see what changes and adjustments can be made. But the message that I want to give today is a simple one. If you are a business and if you are not following the rules which have been laid out, the law that exists in this country allows the Minister of Health to close that establishment. And the Minister of Health has been very clear to me that she will work with the Minister of National Security and or myself or others to adopt this zero tolerance approach. We cannot allow a business to take risks which can put the community at risk and set us back. And that is not the place in which we want to be.
Thank you very much. And you mentioned in the House of Assembly on Friday the possibility of getting saliva tests on island. I guess, A, can you tell us a bit more about that? And B, now that the FDA has given emergency use authorization to an at-home saliva test, is that something that might be considered?
Oh, you might be stretching my knowledge a little bit. I know that we had a discussion on it on the public health advisory team. The view is that saliva testing, one of the challenges with our current testing regime, of course, is that it consumes an incredible amount of personal protective equipment. I think we've done 6,600 tests thus far. And so each time you have to do one, you know, there's different change of gloves, all the rest of the PPE, which is necessary and required. During this call, there was the discussion about what are the future tests that are there. I know that the hospital is looking at this test. I know that Dr. Weldon had confirmed that the equipment of which we currently have can be used for a saliva test. And it's additional equipment which needs to be ordered in order for the capturing of that and also the extraction of the viral RNA from that particular specimen. So the view that was given was that it would take about, I think they said it would take about 3 weeks. And so the discussion was whether or not we could possibly get that done any quicker. If it's done within 3 weeks, then that'll be great. If it's done before 3 weeks, then it'll also be something that is good. But the view is that that can possibly also be used at ports of entry, of which we've seen in other places, and it can make the collection of these things easier. What's important is to make sure that it is an effective use of detecting the virus. So our scientific advisors will give us the advice on those particular matters.
Appreciate that. Thank you very much. And Minister of Health, we heard, I think it was on Friday, that there were 3 cases at a rest home. Can you tell us in the first instance if that rest home was a place where there had been previous confirmed cases, and can you tell us what steps were taken to manage that outbreak there?
Okay, I'll answer the second part of the question first. As is always the case, we do have a team that works very closely with rest homes to ensure that they have all of the educational information that's required with respect to infectious control, cleanliness, making sure that they have sufficient staffing resources as well as PPE. And then the first part of your question, as the Premier eloquently indicated about 10 days ago, and you've heard me say it several times, unless it's viewed as a public health concern, we would rather not disclose the name of the rest homes because there's a number of things that will stem from it. First and foremost, obviously, it's an issue concerning the families and the caregivers that work tirelessly at those rest homes, and whether or not what we don't want to do is have a situation where these rest homes are adversely stigmatized because of information that's fed through the press. And then secondly, as we've noticed, previously, there are certain concerns that are raised by family members as well as staff concerning the demonization, if you will, of a particular rest home. We do recognize that we do have community local transmission, so it may very well be a case where we will see positive cases. However, I think what's more important, if I could say, is the fact that we have such an availability of testing resources that persons can get tested, as well as the rest homes. You would have noted about 2.5 weeks ago, we directed that all rest homes be tested as well as retested, and we're continuing on with that exercise. So the fact that we have such a capability of testing available, I think, is a huge testament to Bermuda and our ability to identify, address, and arrest COVID-19. We know we can't eliminate it, and we are all hoping and waiting for the time when there is a vaccine available and or a cure. However, in the meantime, one of the best things that we can do is to continue testing, as well as to ensure that the rest homes have the proper guidance and support that is being provided by the Ministry of Health.
Sure. And certainly, sorry, just to be clear, I wasn't looking for a name of a rest home. I just wondered if it had been somewhere that had previously had confirmed cases. Would you even say that?
It's a rest home that had previously been tested, as all 21 had been previously tested.
Okay, but we don't know if it had previously confirmed cases.
I would rather not disclose that.
I understand.
Thank you.
Thank you. Thank you very much. That's everything.
Good evening. Last Wednesday, Dr. Ashton talked about pediatricians not seeing inflammation, i.e. Kawasaki-type symptoms in children in Bermuda. He inferred that they'd seen local cases in children, and the Bermuda Broadcasting Company is aware that at least one school closed earlier than most in March, when a child and a father was suspected of catching the virus overseas at half term and bringing it back to the island. Yet the government has never reported a case below the age of 18 years old. Our question is, have there been any children who have caught this virus who are younger than 18 years old? If yes, why has the government not reported these case numbers? Local parents will surely want to understand the risks.
John, for that question. There have been no cases, as Dr. Ashton indicated, of the Kawasaki disease being identified here in Bermuda. And there have also, I can confirm, not been any cases of positive COVID-19 for persons under the age of 18.
All right, thank you. What is the average passenger load on the buses since they started running last week, Wednesday? And are there any routes that need more service than others? Over the weekend, Bermuda Broadcasting Company witnessed public bus drivers who are transporting passengers while wearing surgical masks around their necks and not covering their mouth and noses. What can the government do better to ensure that safety of all who ride the buses?
Thanks. On the question of the average load, I think has been 5 per run, which I think means that people are heeding the guidance to only use the buses when absolutely necessary. The issue of which you mentioned about someone not properly wearing a mask is a concerning one. And I'm certain that I will raise that matter with the Minister of Tourism and Transport tomorrow during the cabinet meeting.
Okay, thank you. What is the likelihood of contracting COVID-19 while outdoors?
I think that's a very good question, Don. And in fact, I was just reading a study that was over the weekend, and it was effectively showing that two things. One is that the transmission rate of COVID-19 is reduced by almost 75% when people wear masks. And that figure is also comparable to persons exercising proper physical distancing, i.e. 6 feet or more away from each other. So I think that the closer that the interaction is with an individual, the lack of mitigants such as mask and less than the 6 feet social distancing or 3 feet in certain circumstances, but the absence of a mask greatly increases a person's prospects of catching COVID-19, particularly if you're engaging with someone who may be pre-symptomatic or asymptomatic. So the message, or the takeaway, if I might add, is that we can try our best to avoid this and minimize us becoming infected by COVID or entering contact with someone with COVID-19 and innocently spreading it to family members, loved ones, or vulnerable persons that may live within our household, simply by exercising proper physical distancing and always wearing a mask when you're in public.
Just to clarify on that, are we aware of any cases in Bermuda where somebody caught it outdoors with close contact with somebody rather than?
I don't have that information. We do know that there have been cases of local transmission. I've reported that, but how that local transmission occurred insofar as whether or not it was within a family unit, whether they were inside or outside, I don't have that information at my disposal.
Okay, thank you. Since Friday, government reported 8 new cases and no recoveries. 2 new cases were imported, 4 new cases were known transmission, and 2 cases are currently under investigation. How many of these cases came from the rest homes? How many new cases came from the prisons? And how many of these new cases are from public workers? How many of these cases were just out in the general public? And are we concerned about the sudden spike in cases over the weekend?
So that's so tricky. I'm not tricky, but 5 questions in one is very, very, anyway, I'm going to answer you though, but thank you for those questions, Don. Those are really important. I can tell you, not necessarily in the order that you asked, so forgive me. 3 cases were from rest homes, as was reported in Friday's Daily. None are from the prisons. Government workers are invited to take the test voluntarily at Southside. So insofar as an exact number of how many are availing themselves of that, we know the total numbers, how many are government workers versus you and I and members of the community. We don't have that. It hasn't been segregated, but we are still encouraging all members of the public, in particular government workers, essential workers and the like, to avail themselves of the service at the Southside. But insofar as segregation, how many are government workers versus how many are working in other essential areas and so forth. I don't have that information with me. The concern that you raised concerning the spike, we're always concerned if there's an increase in COVID. 1 positive case of COVID-19 is of a tremendous concern to all members of the community, as it should be. However, and I can't emphasize this enough, and I apologize in advance for sounding like a broken record, we can all individually take steps to try to minimize the spread of COVID and having positive cases by exercising physical distancing, wearing our masks, and proper hand hygiene. And in particular as well, if you feel ill, stay home. So I'm sorry I sound like a broken record, but it's an important message that has to be repeated over and over again so that we can get the message out, because we can help to avoid this. And you've heard the Premier speak a few moments ago about some of the observations that were brought to his attention over the weekend. We can avoid this. I don't think anybody in this room or in this country would like to revert to shelter in place again, but it's about health and safety, and we have the control.
Okay. And my final question. We have lost 9 people in Bermuda so far to this virus. Before COVID-19 was recorded as arrived in Bermuda, the chief medical officer and the head of the hospital stood during a press conference and mentioned several times that the Premier had essentially given a blank check to help get prepared for testing and treatments. Does Bermuda have ECMO machines for the island for the most critically ill patients? And do we have the staff to operate these machines?
That is a question that I wish you would have asked when Dr. Richmond or Dr. Ashton was here just a couple of days ago. I will undertake to get that information for you and report back to you, but that would be best asked of the hospital. So I will get that information and get it to you tomorrow.
All right. Thank you very much.
Good evening. Minister Keynes, there are an extreme highly amount of people that
I can't hear you, sir.
there are high numbers of persons that are looking to renew passports. The process right now is done. When will passport renewals, your office, be opening up for passport renewals?
All immigration services will be fully operational by June 1st.
Next week, Monday.
Yes.
Another question for you, sir. Are you extremely concerned since the shelter in place has been lifted that we've had an uptake of gun-related incidents? Are you concerned that these incidents are occurring? One was in Warwick and one was Saturday night.
Of course, we are concerned with any gun-related instance. It makes our country skittish. It makes people that live in our neighborhoods feel unsafe. This is something that I had a discussion with the police commissioner today, and we are looking to accelerate our strategies. Pastor Leroy Bean, that is in charge of the Gang Violence Reduction Unit, he and I also met today, and he shared with me some strategies and some things that we were doing in our community with our at-risk populations to make sure that they are being taken care of, that they're being engaged, and that they have the opportunity to contact people if they indeed need help and or support. Trevor, this is our country, and oftentimes we don't realize if there's a shooting on Court Street that it has an effect on us in total in a lot of different ways. It is our endeavor that we, number one, right-thinking people condemn the activities. If they know of anyone that is involved with these activities, to go to the Bermuda Police Service to form a complaint. Do not give safe harbinger to people that have guns or who are doing this behavior by hiding guns or by keeping the information silent. As a community, I believe that we can tackle this and work together. The history of us dealing with crime, whilst people do get away with it in the short term, it is highly probable that persons that do carry out this activity will be apprehended, will face justice in courts, and then face a period of incarceration.
Thank you, sir. Premier, this one is for you. What might you say to landowners that have mortgages to pay at the bank and they're not receiving income from their tenants because of not working? The banks are not, well, in about 2 to 3 weeks, the banks are going to be demanding their share of mortgage payments. What might you offer as a way out or relief for these homeowners?
As the economic challenges continue, we'll go ahead and take a look at what more work may need to be done. So for the instance of persons who may not be receiving money for their rental payments, those are circumstances which may continue. And so for the government, it's responsibility to work with the banks and to work with individuals to find how we can assist. But I think that it would probably be a better question to be asked that when the relief which the government made sure was there in place for persons in that actually runs out. Our job is to make sure we get as much of the economy up and running as quickly as possible. And that's why it's so important for all persons to, not all persons in the country, to cooperate with the necessity to obey the rules and regulations so that we can keep virus transmissions low and to move to further opening phases so that more persons can return back to work to safely provide for their families.
And since you mentioned the unemployment relief, has that date has the date been extended, or is it going to be extended?
The date has not yet been extended. I think when the Minister of Finance was asked a question last week, he said it's something that he will look at if it's necessary. But our first and foremost responsibility is to try to get as much of the economy open as quickly as possible, as long as it is safe to do so. And that's why it is urgent for everyone to obey the rules and regulations which have been laid out so that we can reduce the possibility of transmission and to get more persons back to work so they can safely provide for their families.
Good evening, everyone.
Good evening.
Maya Placer here for Media Maya. My first question to Minister Wilson. Last week, I had asked you how many daycares had applied to reopen during phase 2, and you mentioned there was only one. Has that number increased yet?
Not yet, regrettably, no, not yet.
Is there any thought to any of the summer camps being able to reopen and apply for anything?
That I have to say, the summer camps, I was part of a discussion this afternoon with a subcommittee, cabinet subcommittee that Minister Kane spoke about, or the Premier earlier today. And that is an issue that has been discussed, as well as with respect to the summer camps and a couple of other matters that relate specifically to the provision of services for children. So those are considerations that are being discussed by the cabinet subcommittee insofar as whether they will open and what they will look like. But there, at this point, has only been one application that's been made for the provision of daycare services. There have been a couple inquiries for persons that have home care facilities, because if you have less than 3 people and you can operate within the physical distancing requirements and so forth, you can open those. So I'm a little bit disappointed that we haven't seen more of an uptake of that, but I suspect it's still early days because we only announced it last week.
Thank you.
Mhm.
And I believe my next question is for you as well. I was just informed this is a question from the community who is a member of the community and also who works at the hospital. She says, can you please ask the Minister of Health why people are receiving negative test results from Southside after booking an appointment online but not showing up for an appointment? These persons have never been tested, but they are still receiving results. This questions whether or not the numbers that you guys are reporting are valid. So my question is, are people getting or receiving results even though they have never been tested?
I'm not exactly sure how to comment on that. I would have to check into that. I don't know. I know that there have perhaps been some hiccups with respect to the computer system. Computers aren't infallible, but I would need to look into that.
Thank you very much.
Mhm.
Those are my questions.
All right. Well, thank you all for your attention. Thank you for your questions. The next update from the government on COVID statistics will be via press release from the Ministry of Health on Tuesday and on Wednesday. And the next time that I will be joining you in your living rooms will be on Thursday, where we will have further updates from the government ministers in addition to any changes which may come from tomorrow's cabinet meeting. So with that, I wish everyone a wonderful and pleasant evening. Thank you and good evening.
This is a message from the government of Bermuda.
Anyone